This is an interview with Dennis Olsen on July 11th, 2008 at the Centers for Disease Control and Prevention in Atlanta, Georgia, about his role in the Smallpox Eradication Campaign. The interviewer is Melissa McSwegan. With this interview, we are hoping to capture for future generations the memories of participants and their families involved in eradicating smallpox. This is an incredibly important and historic achievement, and we want to hear about your experience. I have some questions to guide you, but please feel free to recount any special stories or anecdotes that you remember about events or people. The legal agreement you signed says that you are donating the oral history to the U.S. federal government and it will be in the public domain. Now, for the record, could you please state your name and that you know you are being recorded?
My name is Dennis G. Olsen, and I know that I'm being recorded.
Okay, great, thank you. So to start out with, would you briefly describe your childhood and pre-college education and how that led into you working in public health?
Well, I grew up in Bend, Oregon, and did all of my pre-college schooling there. Went off to the University of Oregon then for my college work, and I can honestly say that none of that prepared me for a role in public health. My first inclination to be involved in public health was through the University of Oregon Placement Service, where I met a CDC colleague, E.J. Spike, and I was recruited into the CDC and spent 32 years with the organization.
Okay, well, great. Well, how did you then become involved with the Smallpox Eradication Campaign?
I was first recruited to come back to Atlanta out of my assignment in Los Angeles, California, to actually be involved with the early malaria eradication effort. And as the politics of that were working their way through Washington, and it was determined that what the plans had been were not going to come to fruition, I was contacted to ask if I wanted to go to West Africa for smallpox eradication. Agreed to do that, got married to my lovely wife, and off we went to the country of Liberia and spent 3 years there. After returning from that, we knew then eventually that the Indian program was going on and made overtures to be one of the people who went to India for a 3-month assignment. At the conclusion of that and the enjoyment of that work and the colleagues from around the world and the imminent success of the program, I asked if I could go back for a longer term, and we were accepted and returned for a 2-year stint. And at that time, I was named the WHO World Health Organization coordinator of the smallpox eradication effort in the state of Uttar Pradesh, a population of about 110 to 120 million people. My role was to assure that the program policies were being carried out, searches were being conducted, that the international staff and the Indian domestic staff that were working on the effort had the resources that they needed to carry out the function, to do spot assessments of the work at the primary health care centers and or hospitals, and largely also to be the banker and make sure all the funds were flowing in the right direction. A very enjoyable experience and met a lot of interesting people. Besides Uttar Pradesh, my wife and I went to Bangladesh for a 3 to 4 week period of time to assist in one of the major searches and quite possibly look at an assignment in Bangladesh that they needed an administrator, and I'm a public health advisor, not a physician. We decided that we appreciated more the Indian aspects or that project and returned to Lucknow and carried out those functions for another, I'm guessing now, 6 to 7 months. And then we were reassigned into Delhi in the regional office in order to be the senior administrator for the program for its duration in India, and participated with the International Commission to declare India smallpox free. And so quite an interesting period of time for us, and we really enjoyed the work.
Describe a little bit your relationship with the host country counterparts in India and Bangladesh.
On the first assignment, the 3-month assignment, we were working directly with I was assigned to a city in Bihar state, or a town called Bhagalpur along the Ganges. And our immediate relationship was with the health officer of that town. And the people who had gone before, of which there were at least 2 others, possibly 3, had developed a strong working relationship. So my fitting into that was just as simple as it possibly could be. There was absolutely no difficulty at all. We could work and do what it was that was required, got support to the extent that it was available from the locals, and of course a lot of support from CRO in Delhi. So it was a very easy experience that way. And all of the people, staff for the most part at the primary health care centers had been heavily involved with the effort to eradicate smallpox and participated to the extent that their abilities allowed. There were those times when we had to do a little extra encouragement in some areas and so forth, but we still had very strong support of the local health officer and the Indian government from Delhi. Those people made periodic visits to assure that these relationships were maintained and overcame any of the infrequent difficulties that approached. When I became the WHO coordinator in Uttar Pradesh, then I worked directly with the Minister of Health for that state and the staff at the other levels in order to carry out the functions. Again, these things went very smoothly because of the overall direction of the Indian government from Delhi and the support that they provided to the program. And those relationships never got in the way of carrying out function. That's why I think the program was successful to a large degree.
What would you say would have been the biggest challenge while you were there?
That's a hard question. There were the challenges of, first of all, motivating the population to report rash-like illness. So many other things were impacting on the population. Of course, we instituted a reward system, a financial reward system to help with that. The difficulties of just getting around in the country. Not all areas had a road network been established. Quite often, those that were established were interrupted for flow of water to farm. Quite often where we had to go, roads had never been established. So just getting to investigate an outbreak, getting to it was difficult. Getting supplies sometimes to areas were difficult. Heat, surviving in certain areas were difficult. But all of those things could be overcome. It just took a little bit longer to do things than one might have hoped for.
And what do you think, you've talked a little bit about the relationships that you've had and other things that helped it to be very successful, but what do you think were the greatest successes that you had during that time?
Well, the great success was that smallpox was eradicated. And I think that it also a success to show that through a combined effort and the cooperation, you could, excuse me, tackle a difficult situation and have some success from it, and therefore the encouragement to continue with whatever effort you were in. Quite often we were approached out in the hinterland, if you will, about doing something for other sets of problems that existed in the country, something to do with water, something to do with sanitation, to go beyond our scope of work in smallpox eradication, to add some assistance or input into these levels. And of course we would report these sorts of requests back through the system, but I think our experience and our being on site and the success of the program probably led, I think there is evidence that it did lead to attention being paid to these sorts of circumstances and problems as well, and having them attacked when resources and political support were provided. So.
How did your family adapt to living abroad, both in Africa or in
Well, my wife
India
and I were together. We don't have children. We're still married, so my wife, Carolyn, actually was quite involved in the Indian program. Some of the things that I would make recommendations to the central offices in Delhi with technical graphs and so forth that had to do with demonstrating how you could show your project was moving in a certain direction or had these successes or these failures. Carolyn, being an engineer and having these kinds of talents, put these things together. So, and she went with me on the searches out into the field, and through her own oral history, she'll tell you some very interesting stories from her side of it. But I probably would not have made the full 2 years if she hadn't have been there.
So what was it like living in India beyond the working environment, just living in India and participating in the culture?
Well, I tell you, I had already been to Africa with that program, and so when I thought that, or not thought, but had been accepted to go to India, the African situation would prepare me, and it was largely true. But I do remember getting off the plane in New Delhi and the heat and the just large numbers of people and the immediate differences with just an overwhelming humanity kind of thing. I thought, what in the world have I gotten myself into? And we had a few days of training in Delhi. Then we were sent out into the field to be with colleagues that had already been in country for 2 to 3 months to gain some experience. And I met a good friend, Russ Charter in Bareilly, who showed me how to get the Jeep stuck as soon as you could. But did demonstrate how work was done in the field. And then I went off to my assignment and met another CDC person waiting for me in Bhagalpur, Dr. David Heyman, who had been there for a couple of months, and he was kind of a light yellow. He had hepatitis. So I thought, well, if he can put up with that, I can put up with whatever's here. But Bhagalpur was a small place in comparison to the capital of Bihar, Patna. Patna was a small place compared to Delhi. And I guess the point of this story is that when I got back to Delhi after 3 months, it looked like a large European city that I could definitely survive in. That's when, with that successful 3 months, I asked Dr. Henderson, D.A. Henderson, and Dr. Bill Fagey if it would be possible to come back to India for a longer period. And after that longer period, both my wife and I asked again if there was some way to stay with an active program, be it immunization, diarrheal disease control, malaria, whatever it is that we might do to remain in India, because we enjoyed the experience so much. So we met a lot of interesting people. The Das family in Lucknow, we lived above their residence. The people that we rented from in New Delhi, people in the field, it was just a pleasurable 2 years.
Have you maintained any of your relationships with people you met in India at that time?
You know, 30 years have passed, and I'm not sure how many people are. But the answer to that, short answer to that, is not from the Indian side, although I understand we will be seeing a Dr. Dutta, who is a senior person in the Ministry of Health. He's in town, and I look forward to renewing that relationship. We have shared with our CDC colleagues and others over the years when reliving these experiences, honing our lives and things like that. So.
What would you say are your most memorable moments from working with the Smallpox Campaign?
Oh, my goodness. One was going out to the very first smallpox investigation in Bhagalpur with Dr. Heyman. We had to walk through the rice paddies and wade through a river, and my shoes were not appropriate. I lost the nails off both big toes, had full foot blisters underneath my bottoms of my feet. Had to have tea and sugar and salts to get the electrolytes up, and rode out on a donkey. It was thanks to Dr. Heyman. Other experiences. You're going to have to take some time to reflect. The International Commission, we happened to be there at the end of our assignment when they the Commission came and announced that smallpox was eradicated from India. That was so satisfying to have spent the time and then to actually be there at a moment when history had been made. That will certainly be hard to well, I'll never forget it. So. And the other, I think, were just the individual relationships we met with people. The staff in Lucknow, from the secretary to the very important and very good friend, paramedical assistant, Rajendra Singh. It's just things like that that stick with you. And if it ever could happen again, would not hesitate at all to do it again.
And how would you say working with this campaign has affected your life and career since then?
Well, I don't have a career anymore. I retired in 1994. It affected our life is that we're extremely proud that we had the opportunity to do it. Like to think that we did it well, and enjoy the relationships that we still have with people that went over and did these sorts of things, and days like today when we're back to remember what we all went through. It wasn't always easy. I don't ever want to let people think that it was just all good times and success. We lived in very harsh conditions a lot of the time, and we put ourselves in jeopardy many times. But just the pride of having done it, the pride of success, and listening just this morning to what's happening with global programs, we like to think that maybe we were, in a small way, part of what allowed these things now that are now happening to move forward and hopefully enjoy some of the success that we had. We did the pioneer work, they like to say. So.
At what point during the program while you were working on it, at what point did you know that smallpox would be eradicated?
The day they announced it.
So you weren't convinced until then?
Well, you know, you always wait for the next person to come forward and say, we have a report of rash-like illness. And you might have gone for 6 or 7 months or a year and think, you know, this is pretty much it. We're sort of wrapping up. So it can happen. When I left Liberia in the African program, we were sure for a whole year that we had no smallpox, quite successful. And then someone came down from up country and said, we have a woman and child in the hospital with rash-like illness that looks like smallpox. So when my wife and I were just ready to leave country, our assignment was over and my replacement had arrived. So the same thing could have happened in India. As it turned out, the African issue was monkeypox and not smallpox. So. But once they made the announcement in India, we had assurances after many, many searches that there was no illness or no smallpox. Of course, the search went on for another couple of years to continue to assure that. It really didn't end at that point. It was the point where we said that we had reached that particular part of the goal. But we had to confirm it again. So,
what were the important lessons that you learned from smallpox eradication that you then applied to other parts of your career afterwards?
Well, the career after that was some domestic program work in childhood immunizations, then international work in HIV/AIDS, and some work with international immunizations, diarrheal disease control, and malaria control. For the international things, what was learned was how to deal in an international setting, what things had to be attended to allow the program to have some success in the relationships that you needed to develop with the host country. How important it was to assure that you had the proper logistics before you tried, got the plan established, then the logistics to carry it out and the resources to carry it out. And the important, very important tools of assessment, continuing to look to see where you were along the road to trying to achieve your objective, not just assuming you were doing okay, but actively making sure from tools to assess your program activities. Interpersonal relationship skills were honed, I think. How to make sure that you were, for example, whatever credit might be accruing, that you made sure it was the local that got the recognition. We knew we were doing okay. We didn't need to be told. So those kinds of things. I think those are always helpful. They're the more mundane things about improving your writing skills and these sorts of things, but I think I touched on the more important ones.
Now, you have spoken a lot about the successes of the program. What if you had been the one running the entire program worldwide? Is there anything that you would have done differently, or that you would have changed about it?
No, I don't think so. How can you fight with success? You know, I had never ever thought of myself having those kind of capabilities. When you work for someone like D.A. Henderson, Bill Fagey, those are the people that have those visions and skills, and at that level, and it's just a happy occasion that we got to be able to be part of it. I can't think of anything I would change. No.
Well, do you have anything else that you would like to add about your experience?
No, I think we pretty much covered the territory.
All right, well, thank you very much for your time, and I appreciate you sharing with us your experience in India.
Thank you very much for doing this.